I'm responding to the question on how we can empower women in WASH. We can provide more resources for women-led initiatives, which will push their initiatives forward and help women take those initiatives to scale. Women should also own their place at the table. There are a lot of discussions about how to increase quotas for women in leadership. But while those efforts are going on, women should equally take their place at the table. And for that, I'll refer you to the book Lean In by Sandberg, who discusses the fact that in the boardroom, women will always sit at the back. They will not like to take the front seat. So women should be encouraged to sit at the table. We can also help increase the capacity of women through soft skills. We need to help women improve their negotiation skills, improve their communication skills, improve their public speaking skills, and this will go a long way in empowering women in WASH. Women should also read more and broaden their knowledge on various issues in WASH. This will go a long way in improving how much they contribute in various discussions while they're in positions of leadership. It will strengthen how much they can contribute. We need to read more. Women should read more. It's very empowering to read, which increases your knowledge base on various subjects. Also, we should spotlight initiatives that women are carrying out in their communities, personal progress that women are making, and other businesses maybe they are leading or initiatives that are being championed by women. We need to spotlight these initiatives, which will empower women, build their confidence, and also raise their profile in the community. That's my answer.
How do you build strong WASH institutions, and what is the role of women? By strong WASH institutions, I'm referring to the service authority and the service provider. A strong service authority means that there's a proper structure in place, a management team, financing for the capital phase, and a good monitoring and evaluation system to provide a consistent level of service. The service provider also requires the right structure, the right rates or tariffs to cover the cost of services and routine repair and replacement, and proper operation and maintenance. In addition, a water resources management plan is essential to ensure that the water resources continue to provide the water for the water system. And women, how do they fit in? Well, we need more women in the water sector. We need women's expertise, their skills, and their leadership to grow this profession and keep the water flowing.
While efforts are being made to address the sanitation stepchild syndrome in the rural areas, the urban areas are unfortunately already suffering from this syndrome. To address this, governments must take deliberate and intentional efforts by developing policies that clearly and directly address urban sanitation. And what better time to address the urban sanitation challenge than now, when we are in this unfortunate pandemic situation? Governments must start by clearly defining institutional, regulatory, and service delivery mechanism. This must start with naming a ministry that can be held accountable for lack of, or indeed poor sanitation services. Such a ministry will ensure that there is a dedicated budget line for sanitation and not lumped up in the usual way of a water and sanitation budget line, because that does not address it. A dedicated directorate for sanitation should also be created, led by a senior government official like a director. The regulatory framework for sanitation must be developed as well to promote better quality of service and appropriate financing mechanisms. At operational level, there should be clarity of roles and responsibilities for the delivery of the whole sanitation value chain, including containment, emptying and transportation, treatment, and reuse. Also, even those areas that are based on sewer networks. Adoption of appropriate approaches such as citywide inclusive sanitation as a planning tool with its principles of leaving no one behind are also important. CIWIS, or citywide inclusive sanitation, defines how the service will be sustainably delivered, engaging all the key stakeholders, that's municipality or local government, health sector, environment, the utilities, the private sector, the community, and indeed civil society. And in my view, utilities should primarily be responsible for planning, developing, and managing treatment facilities. We must come out of this pandemic together and stronger as utilities. Thank you.
To scale up urban sanitation provision, we need a mix of traditional and non-traditional approaches. We need robust service providers which approach sanitation in an open-minded way and identify the most appropriate systems for a given city at a given point in time. We need sanitation services which are consistent with the demographics, topography, density, ground conditions, and the other services in the city. We need robust service providers responsible for both water supply and sanitation to bring an economy of scope and of scale, permitting the use of financial and other cross-subsidies. All stakeholders need to think differently about urban sanitation. Conventional sewers and wastewater treatment is one approach if rationally designed, but we need a menu and a mix of approaches tailored to the nature of the world's burgeoning cities with so much informality, including non-conventional sewers, on-site sanitation and FSM, container-based sanitation and more. In all cases, interventions should be designed for their sustainable operation. Governments should provide incentives to make such approaches the norm, putting in place the policies, institutions, and regulatory and financial frameworks which enable the delivery of sustainable services. The transfer of investment funds should be based on establishing robust service provision and on creating mechanisms by which rational investment decisions are made based on both the capital and the running costs of the services. Funding schemes should be results-based with disbursements related to the delivery of sustainable services. Good examples from around the world should be shared and adapted to local realities. Capital and running cost subsidies, where needed, should be intelligently designed and targeted. A robust service provider should be technology blind. It's not a question of what off-the-shelf technology do we use, but how do we get sustainable services to all? Informal FSM services, for example, should be understood, regularized, supported and monitored. Robust utilities should work together with these small-scale providers. Behavior change for all stakeholders is a key ingredient of sustainable sanitation service delivery. And finally, political prioritization of sanitation is crucial if we're to rapidly scale up urban sanitation services. And we need to do so through a combination of both well-established and innovative approaches.
What I've seen is that there's a lack of availability of capital to go into projects, not because of the fact that there's a limited amount of money, but instead because of the fact that there's a limited knowledge between project sponsors and the sources of capital that might be able to help those projects to deliver on their goals. So my big and bold idea to help to ensure the delivery of what Peter and the rest of the Rock Blue team are calling the Marshall Plan for water and sanitation would be to create a platform where there's a link between the seekers and the sources of capital, where those entities that are looking for finance are able to come through and put their projects together and list them in a way that's streamlined and easy for the sources of capital to be able to understand. To put it in simpler terms, if you are a project sponsor and you know that you're looking for money, preferably at concessionary rates, rather than going to the commercial banks for something which is more market rate, being able to list those projects and have the concessionary lenders understand what those projects are about, and or in certain instances where the projects are not commercially viable and they're in search of grants, in both instances, A platform like this would be critical in order to ensure that the money that's required to deliver on these projects moves through in a meaningful way. I very much look forward to walking through this sort of an idea with you during the course of the rest of today's session, but I hope that this at least has provided some food for thought. Thank you very much and have a great day.
So I think the best starting point for how do we institutionalize systems-based approaches is really to start with the shared vision within your organization, but also with other organizations. What is the challenge we're trying to address? What is working well and what is not working? And really to dig down into the reasons behind that in terms of the challenge, whether that's to do with service delivery, whether it's around policy, whether it's around the ultimate outputs and the impacts on health. And following that, I think the three really important things in terms of institutionalizing, taking on board a systems-based approach is really, firstly, to understand and map your own organization's position in that system, whether you're the government, whether you're a development partner, an NGO, a financing institution. What's your role in the system? Who else do you interact with? And consider not only the technical aspects, engineering, financing and so on, but also perhaps the more intangible aspects around political incentives and influences. The second thing is to really look at your own organizational incentives. What's driving your behavior? Why does your organization do certain things? In whose interest? Try to really understand that, again, in relation to the system in which you're operating and functioning. And thirdly, I'd say act collaboratively. Very much it's the case that we can't really affect systems change if we're trying to do this on our own. We have to work together. No one organization is big enough, financially strong enough to really address systemic change. So we have to work together. And underlying all of these points is the fact that it takes money and time to carry out a systems-based approach. It doesn't just happen. So you need to set aside money for budgets to support the facilitation process, make sure people have the right skills to be supporting these change processes, and really recognize it as a valuable investment and input into any activity that you do.
A famous US politician, Tip O'Neill, once said that all politics is local. Well, I would suggest that all water is local. The most important decisions about how, about when, about where to invest in water resources in Africa, Asia, and Latin America aren't made at the UN or European capitals or Washington, D.C. They're made in each country, each province, each community, each household. So it's vital to decentralize decision-making in the water sector, as those households and institutions locally know best where the challenges are, and they know best what the most appropriate solutions are. So what does this look like? Well, first of all, there needs to be a clear line of communication between the end consumers of drinking water and the local and national authorities, both public and private, responsible for delivering that service. Governments from the top down need to communicate their water commitments clearly to the end users, especially as we emerge from COVID by, for example, posting water budgets in physical community centers and online in an open, transparent fashion. Citizens and those governments then need to communicate constantly about progress or lack thereof, and those lines of communications need to be maintained with all parties playing a proactive role. For example, if tariffs need to be raised, this should be considered in an open, transparent, inclusive fashion, prioritizing the needs of families, including the poorest of the poor, and including governments, public and private utilities of all sizes, and other relevant stakeholders. The key question here is, are citizens getting the water they have been promised at households, at healthcare facilities, at schools, at marketplaces? If not, why not? How does a citizen make that problem known? Is it clear who to call, who to email, whose door to knock on? And these conversations need to happen village by village, street by street, all the way up to national constitutions. The bottom line is that water is a very sensitive sector. Life and death hang in the balance, and COVID has made that very clear. Therefore, there needs to be a well-paved two-way street between people and their governments at local and national levels regarding the provision of this essential service, with each stakeholder actively holding up their end of the bargain.
Good morning, good afternoon, and good evening. My name is Joel Kolker. I'm the program manager at the Global Water Security and Sanitation Partnership, which sits in the World Bank. I've been asked the question on how must government and the private sector interact, and I think there's a short-term answer and perhaps a more complicated answer. In the short term, the answer is clearly with integrity, honesty, transparency, and a deep understanding of each other's needs. And ultimately, that equals creditworthiness. Now, in the longer term, or a deeper answer, may be perhaps to look at what each party is looking at and assessing the business kind of relationship they want to have. So the private sector, in terms of looking at the public sector, is basically going to look at two things. What's the operational efficiency of that provider? And what are the governance and institutional arrangements? And by this, I mean the technical and financial arrangements that govern and oversee the water provider's operations. What is their efficiency in collections, in non-revenue water, in staff to the number of customers, and all the other things that we look at in terms of our sector. On the governance arrangements, they're going to look at who owns it, what the money transfer is, who has the legal and financial and fiduciary responsibility, and what are the institutional arrangements. On the private sector side, what the public sector needs to understand is the concept of risk. What is the risk that the private sector is taking in terms of providing resources to the public sector? And this is really looking at the business operations as well as the risk operations. They may in fact be simply not familiar with the water business, which is highly likely in most emerging markets, but they also may be looking at mitigating that risk, either through lines of credit or guarantee facilities or other things along that line that would mitigate or reduce the amount of risk. Both of those factors are quite critical in terms of assessing the resources that the private sector might be willing to provide to the public sector. So in terms of what must the government and private sector do to each other in terms of interact, I go back to the main point: integrity, honesty, transparency, and a deep understanding of each other's needs. Thanks very much. Bye-bye.
Hello, how are you? I'm Margaret Maina from Kenya. I'm a water chemist by profession, and also I have a passion in sanitation and also a wash expert. I'm happy today because we are discussing how we must overcome barriers of women participation in the sector and also in the fight against COVID-19 and SDG 6. Women play a great role in this sector because by the end of the day, they are the water users. They are the caregivers at home, especially at this time when we're having COVID-19. They are also the health workers for their families when we are in lockdown. They must make sure that we observe the Ministry of Health protocols. In the workplace, although there are not many women in the leadership positions, majority are the ones working in the sector. The only unfortunate thing is that they have not taken over the leadership positions in the organizations, and these are the barriers that we need to bring down because women are capable, just as men are capable. They have gone to the same schools, that is what I always say. They are trained by the same professors, so they are up to the task, and women can do better than men if given a chance. That's what I believe in. So at this time when you're discussing post-COVID issues, we need to put into consideration that the role of women, it has to be relooked afresh, because women are not there when the decisions that affect them most on the tables are being discussed. They are always on the sidelines, and this is the myth that we need to remove. Women are the ones affected by water scarcity. They are the ones who have been drawing water to make sure that their families observe the medical or health hygiene protocols. They are the ones who are providing facilities for hand washing in their homes. Even at the office level, professional level, they are more keen in making sure that the water profession is recognized as a first line in preventive of many diseases. Because by the end of the day, they are the ones who carry the disease burdens when they take their families to hospitals and when they give them care. So I'm happy that with this realization, post-COVID, we are going to put more emphasis on inclusivity, inclusion of women, and creating space and putting women at the center of all this. Because in this COVID-19 era, women have been affected by the conflict in their homes, lack of jobs, but the resilience of women have seen them come out stronger, and they'll come out stronger after this COVID-19. So I just want to say that we need to remove the barriers. Women are capable of working in every situation, and it is my prayer it will be done. Thank you so much.
Greetings. The latest figures from the United Nations indicate that 1 in 3 citizens of our planet still lacks access to safe drinking water, and more than 673 million still practice open defecation, and 4.2 billion use sanitation services that leave human waste untreated. That's why something akin to a Marshall Plan is required to scale up access to water and sanitation, addressing UN Sustainable Development Goal 6, water and sanitation for all by 2030. We've now heard from highly respected professionals addressing specific subtopics of WASH to dramatically scale up access to water and sanitation. Their suggestions must continue beyond this webinar for us to see substantial impacts on access to water and sanitation. And I'm looking forward to answering questions from the audience and discussing the how for the balance of this webinar. I was asked to answer the question, how can we make investments or interventions more durable? It's an important question when considering a large percentage of water and sanitation infrastructure and costs show little results into the future. Simply put, they just don't last. And repeat investments in time, effort, and money are therefore required. We don't have the luxury to both address SDG 6 and have to do things twice. In my opinion, what is needed from aid agencies, development financial institutions, governments, and water service providers is a condition placed on all WASH efforts that they incorporate basic tenets of durability or sustainability in the design and execution of their projects. And if these basic tenets are not met, then the projects and interventions should not be permitted to proceed. It is as simple as that. Legislated or mandated durable practices. This is no different than project requirements for environmental protections, social protections, gender inclusion. We need one for durable practices. At Rock Blue, we have defined what we consider the 5 basic elements for durable investments using the acronym ROCKS. Each letter spelling out the 5 elements of resources, ownership, cultural connection, knowledge, and secondary backup plans. If we can mandate durable investments combined with the great ideas from the previous experts, there's no reason why we can't achieve SDG 6. Thank you.